Welcome to Rwanda Medical Academy. Today's lesson is about interventions for critically ill patients. Let's use I-FAST-HUG Mnemonic. Do you know what I-FAST-HUG stands for in critical care? It's an essential mnemonic that summarizes key interventions for critically ill patients. Each letter signifies a different aspect of care. Let's delve deeper into each aspect of I-FAST-HUG and understand their crucial roles in patient care. Infection control forms the very first aspect of I-FAST-HUG. Critically ill patients are susceptible to infections. Thus, practices like proper hand hygiene, maintaining aseptic techniques during procedures, and monitoring for signs of infection are paramount. Administration of antibiotics may be required if an infection is present. Now, let's transition to the F of I-FAST-HUG, which stands for fluid resuscitation. In a critical condition, patients may experience a significant fluid imbalance. This could be due to factors like excessive fluid loss, inadequate fluid intake, or a combination of both. Therefore, assessing and managing the patient's fluid status becomes crucial in these situations. Fluid resuscitation helps maintain adequate blood volume and perfusion, ensuring that vital organs receive the necessary oxygen and nutrients. In essence, infection control and fluid resuscitation form the bedrock of intensive care for critically ill patients. Moving on, let's understand how feeding plays a role in patient care. Feeding is a crucial aspect of patient care, especially for those who are critically ill. Ensuring adequate nutrition is paramount, as it plays a key role in recovery. This might involve enteral feeding, such as through a nasogastric tube or other methods, depending on the patient's ability to tolerate oral intake. It's not just about filling the stomach, it's about fueling the body with the right nutrients to support healing and recovery. Transitioning smoothly into A for analgesia, let's remember that providing effective pain relief is an absolute necessity in critical care. Pain can be a significant source of stress and discomfort for patients, possibly hindering their recovery process. Hence, assessing and addressing their pain levels with appropriate analgesic medications forms an integral part of patient care. Next, let's explore the role of sedation in critical care. Sedation is often necessary for critically ill patients to manage anxiety and discomfort. It's a way to induce a state of calm and reduce stress, especially vital for those on mechanical ventilation or undergoing procedures that could cause pain. The key is to strike a balance where the patient's comfort is ensured without causing oversedation, which could lead to other complications. Transitioning from S to T, we delve into thromboembolic prophylaxis. Critically ill patients have a higher risk of developing blood clots, a situation that can lead to severe complications if not properly managed. Thromboembolic prophylaxis involves measures designed to prevent the formation of these dangerous blood clots. This could be through the use of anticoagulant medications or mechanical methods depending on the patient's condition and the medical team's assessment. Now let's move to the next important aspect, head of bed elevation. A simple change in bed position can have significant effects on a critically ill patient's health. That's right, the H in I-FAST-HUG stands for head of bed elevation. Raising the head of the bed can prevent aspiration and respiratory complications. For patients on a ventilator, it's a simple but effective way to reduce the risk of ventilator-associated pneumonia. And in those with increased intracranial pressure, it can optimize cerebral venous drainage and reduce pressure. Post-operative care also benefits from this practice, enhancing patient comfort, respiratory function, and surgical site healing. Now let's talk about U, stress ulcer prophylaxis. Critically ill patients are at a higher risk of developing stress ulcers due to factors like decreased blood flow to the gastrointestinal tract. Prophylactic measures, such as medications that reduce gastric acid production, can help prevent these ulcers from forming. Lastly, we come to G, glucose control. Maintaining appropriate blood glucose levels is of utmost importance in critically ill patients. It's not just about avoiding hypoglycemia or hyperglycemia. Tight glycemic control is associated with better patient outcomes and fewer complications. These elements of I-FAST-HUG remind us that even the simplest interventions can have profound effects on patient outcomes. The acronym provides a handy checklist for healthcare professionals to ensure they are addressing all the key aspects of care for their critically ill patients. That wraps up our discussion on I-FAST-HUG, a crucial tool in managing critically ill patients. I-FAST-HUG is an essential guideline for the care of critically ill patients. In essence, it reminds us of the importance of infection control, fluid resuscitation, feeding, analgesia, sedation, thromboembolic prophylaxis, head of bed elevation, stress ulcer prophylaxis, and glucose control. Each component of this mnemonic plays a significant role in providing comprehensive care, addressing the key areas of patient management. Remember, every aspect of iFastHug plays a vital role in ensuring the best possible care for our critically ill patients. Thank you for learning. At Rwanda Medical Academy, knowledge is power and value.